Hi, Dr. Shetlin here. Pardon the casual attire, but I just wanted to take a minute to do a quick video blog on PIP, personal injury protection. I know a lot of people have asked, especially the agents, like, how do we explain this to our clients so they get it? And from a doctor's perspective, I see the opposite side of what people writing the policy see and what the consumer sees until it's too late. So PIP is personal injury protection. It's a little package or basket part of your insurance because there's different baskets that cover different things in your insurance. You've got the part that covers your car being fixed or somebody else's car being fixed if you cause an accident and it's your fault. You've got your personal injury protection, which is, I call it your friendly insurance because it's the medical part that covers you or all the occupants in your vehicle to get medical attention like chiropractic, physical therapy, massage, the ER visit, those kind of things after an accident. Before you have to start suing the other guy if they caused the accident and you're not at fault. If you are at fault, that's all you've got before things start to come out of your pocket. So your personal injury protection is, I think, one of the most important, probably the second most important part of your insurance policy. You should never drive without insurance. If you can't afford insurance, you cannot afford to drive, period. It's just, the law should be much stricter on that, on how irresponsible it is for us to drive without insurance because we think, oh, I'm a good driver, nothing's going to happen, but that's not the way life works. So we want to make sure we have our regular basic insurance. Then we have our PIP. Then we have underinsured motorist and uninsured motorist in case somebody caused the accident that isn't insured or underinsured, so it doesn't leave you hanging. But the PIP is awesome important. And what's cool about PIP, personal injury protection, it doesn't affect your premiums. It covers your medical stuff so you can not worry about it and go get checked if you need to get checked. Everybody should get checked after an accident. Big or small, 5 miles an hour, 50 miles an hour, doesn't matter. You should get checked by a certified auto accident specialist physician so that things are documented properly to make sure clean bill of health, you're good, or you're going to need this much care to get back to pre-injury status. Now PIP, this is an important thing to understand, in Utah is only $3,000. That's the state minimum. Anybody legally driving who is legally insured, like they should be, is going to have at least $3,000 worth of PIP. But it's been that since 1967, and medical bills have gotten a lot more expensive since then. We didn't even have MRI back then. You go to the hospital now, it's $1,500 to walk in the door for the ER, and then if you get an MRI or a CT scan, you're going to walk out the door in 4 or 5 hours with a $9,000 to $15,000 bill. And that's just diagnosing. It's no treatment. It's like, here's some pills for anti-inflammatory, for some muscle relaxers, or some muscle relaxers or anti-inflammatories to help with the pain, but it's nothing to help rehab the tissues. So I'm going to tell you, this is the best financial secret out there as far as insurance goes. Talk to your agent. Increase your PIP. Don't cut corners on that. It is the cheapest medical insurance on the planet. You're far more likely to be injured in a car accident than falling off a roof or something. So to have this expensive insurance over here that covers these things versus paying pennies a month to increase your PIP, it is money well spent. Across the board, there are 15 states currently that provide PIP. Most of them, the state minimum is $25,000. So in Utah, to be at $3,000, we're really setting ourselves up for trouble, especially since it doesn't affect our premiums and it's pennies a month. So call your agent. Just say, hey, look, I want to increase my PIP from $3,000 to $10,000 or $25,000, or some companies even go up to $100,000. I'm telling you, it'll be pennies to less than $2 a month for fantastic coverage for you and every other occupant in your car. Dr. Shetlin out. Thanks.